Well, yeah, thank you for the opportunity. I mean, this is kind of neat to be able to do this kind of thing over the course of our interconnected lives, right? Like, I mean, I purchased insurance from you guys and you helped me out in the interesting worlds that we all combine. I really appreciate that part. So good interconnection. Appreciate everybody being here.
Of course.
Cool. Right on. Well, I think what I'll do is I'm just going to start sharing my screen so that I can give this a little bit of go and start this presentation. Anybody that feels like they want to jump in, ask questions, we're going to monitor the chat and be able to do that. But this will kind of give you an overview. Here we go. Let me know if you can't see that, but otherwise I'm going to just jump on in here. So yeah, again, my name is Gwendolynn Diaz. I'm an Ayurvedic doctor. I'll tell you a little bit more about that if you don't know what that is in a minute. And an integrative natural medicine provider. So in the world of medicine in this country, there's all sorts of different licensure, right? And there's a lot of ways that we all have different ways we come to health. My journey really ended up being out of one of I tried some things in my world, thought it was great. Medicine to me was always interesting. And then I came to med school and I thought, oh, this is what I want to be when I grow up. Well, I actually had an abrupt moment where I thought, I don't know if this is medicine that I want to practice. So I ended up in natural medicine school, which was the best thing that ever could happen to me. And Ayurvedic medicine was my specialty. So Ayurvedic medicine is historic, 5,000-year-old plus indigenous medicine of India. Not that it applies from Indian heritage, but what it is one of the oldest systems of medicine gives us a basis of what health actually looks like before we put it into modern context. So I went to school for a long time, maybe 8 years, really, studied deeply the idea of not just the physical body in medicine, but really the interconnectedness of the body. And that has led me down this path of what is modern healthcare in this world? And so the more that I practice, the more that this becomes a really important conversation, is threshold membership. I work with a lot of people that don't carry insurance. So the standard insurance in this country is sometimes provided through your employer. Sometimes it's bought out of pocket on the exchange. Sometimes we just don't have it. And so insurance in general has always been really interesting place of how much money we put in, how much we get out, what are our benefits. I'm sure many of you have stories of your experience interrelating to healthcare and to insurance in the connection of healthcare. So in my practice, I've been practicing medicine now for I think close to 10 years. And it's become apparent to me in a situation where insurance doesn't cover everything. Insurance is a very edged world that says, if you do this and this and this is what we're going to cover. And again, I'm sure there's stories beyond stories, but what happens in the world of practitioners of natural medicine, of alternative medicine, there is not a sweet spot or a black and white system. Oh, sometimes we cover this, sometimes we may cover this. Everybody's experience is different. And everybody's ability to pay into a system that works for them is very much personal. So along comes my ideas that say, why don't we have a place where insurance, if we're truly in charge of our own healthcare, why can't we be in charge of how much money we invest in that for the idea of what insurance does, protect us from things that are beyond our control. I think that's where this idea of threshold membership goes. And as I go through this, I'll give you guys a little bit of details, just how this came to be in my life, and then really the places that this has fallen in place to really see a universal idea of healthcare that isn't necessarily the standard operating procedure. So with that, I'm just going to kind of jump in and talk about what threshold membership actually looks like. So, back to the norms. Every time we go to the doctor, there's a lot of things that come up for people. It's pretty rushed in a standard world. The 7 minutes of what do you need? How can I help you? The system, we all see that there's really big edges on there. It's becoming unmanageable in a lot of ways. The important part here is that money is tied to health. Not that I think that that's like an important situation, but I think it's an important understanding in our world. Healthcare is a commodity. It's what we have to buy in order to think we have to be healthy. First fallacy in natural medicine. The best doctor is not me or anybody else in your world. It is actually you. And so the idea of having money tied to healthcare is complicated. Yes, there are things we can do for ourselves, but when we need extra help, where does that go? How much does that need to cost? Where do we go with that? So 67% of Americans these days are living to paycheck to paycheck. That might be more since I wrote this last year. I'm not sure. But the other really sad part is that people are going broke because of a health event that they have zero control over. And that's with or without the standard insurance. So I know that I deal with this a lot. I see it. It's tragic. It breaks my heart, which is probably what drives me to talk about this more, is that no one should have to go broke in this country because they have an unfortunate set of events that makes healthcare insurmountable for them. So, things that we deal with all the time. One, money and healthcare tie up together. The other question, though, or the other thought that healthcare doesn't provide and doesn't provide in this country well, is prevention. I don't think we have a whole lot of people in our lives that we talk about how to take care of ourselves. I think a lot of us spend a lot of time deep diving down rabbit holes. I think we all should be Googling information on how to take care of ourselves. But is that true? Is it real to us? Does it make good science sense? There's a lot of questions in that. And so being able to decipher importance of what is real and what is not in healthcare is a really big deal. The prevention side too, on the other hand, it doesn't get paid for by insurance. Not the best situation, but it is what it is. So we have to be able to understand health from a different lens. Waiting till you get sick to go to the doctor is a standard operating procedure in this country. What happens if we flip that script a little bit and we talk about what happens if your doctor gives you and prevents you from going to the doctor with these more chronic events? Would we wait until we get super sick until we go to the doctor? What if the doctor was, kind of going to a class to take care of ourselves deeply once a month, maybe once a quarter, maybe learning what our tendencies are to go along with. Prevention is a big deal. And in natural medicine and in Ayurvedic medicine, prevention is a really important part of the healthcare money conversation. And so if we can take care of ourselves even this much better, can we save this many dollars long term? I would like to think so. I think that's really important. And then, some notes on primary care. So everybody should have a primary care doctor. I'm in full agreement. I think that's really important. It doesn't have to look like it does when you go to a typical doctor's office. You don't need a 7-minute appointment. You need a relationship. You need something that feels like, hey, do you know me? Do you know all my stuff around the symptoms? Because symptoms aren't that easy to come up with a plan if we just are looking at that. What's the whole person underneath? What's the story behind all of this? There's a lot to say of knowing your primary care, having an established set of understanding goes a really long, long ways in healthcare. And then insurance. This is a big caveat in my deal. And I don't know if it, my drive in this comes from just the maladaptive way we have used insurance in this country, or the amount of money that's tied up in things that aren't taking care of health. I think there's a lot of facets of what's going on in the industry these days, but insurance in general, in my opinion, is not being served well to the people. I think it's really important to have some sort of insurance, but I think the way it's done, the way it's spent, the way it's monitored has definitely been not beneficial in a lot of people's ways. So finding this, again, this is the question, like, what if we actually decided healthcare was important? How would we reimagine this? I spend a lot of time in my daydreams and in my place of wanting to make the world better. How can we flip this conversation on health? How can we do this to where it shouldn't be hard? It should have a team of functional people that know how to walk within this realm, Because there's places in our lives and our health that are going to come up that we won't have the answers. We do need a team. We need a team of people that can look at this and say, hey, I know you. And you then can feel in trust that says, she's got my back. It's not about, hey, let's do this procedure because this is what we do in the protocol. It's like, no, I see every aspect of this health, and then I understand what maybe would be right for you. And in the end, that is your choice. And that is where you can pick a team, you can pick a pathway to your health that feels like you are in charge, being able to empower yourself to do that in this healthcare system that we see these days is very difficult. A lot of people get talked down to. A lot of people get disregarded for minor symptoms that maybe aren't important to the provider at that point. That's not who's in charge of health. Health should come from us first as people, and then our providers should look at us and say, how can I help you get to where you want to go? Those are healthcare philosophies in my world. So I dreamed up threshold membership. I feel like in my perfect healthcare world that if I was going to take healthcare and make it what I think would be most important, it would have three important features. It would rely first and foremost on prevention. I don't like going to the doctor any more than the next guy. Trust me, if I have to go to a primary care for anything, it has to be, oh God, really? Okay, I'll do my best. And it's not easy, right? But prevention, on the other hand, is an entirely different set. It keeps us healthy before we get to that place. Those little things in the world that say, hey, don't disregard your heartburn. This is an important factor going forward, because if you wait until you burn your esophagus and you get a diagnosis of GERD and you start down the path of GI problems, there's plenty of opportunity for time, money, stress, struggling, and non-good health. So prevention would be, to me, the basis of a really formative healthcare relationship. The second facet, just like we talked before, is direct primary care. I think everybody should have the handle when it comes to, okay, my kiddo's got 103 fever. Yep, it's time to do something about that. Can I live beyond that? If I break my arm and I need to go get it set, these people are your friend. And this is not to berate any sort of good doctors in the world. There's lots of them. But we need to have a relationship with that situation. There's a time and a place. And I think having a direct primary care, there's many ways to do that now. A lot of that can be done online. I don't know where everybody here lives these days, but we live in a pretty rural area. So driving to the nearest clinic for us is 20 minutes down the road. Driving to the nearest emergency room is more than 40 minutes. And so finding a place where we can call somebody when it's a necessary, important thing to happen, I'm like, hey, we need this dealt with. That's a primary care. They're not designed to know a ton about prevention. They're not there to help us handle the side of how to keep ourselves healthy. They're there for the acute problem. And I think that's a really important thing. We just cannot use them for the wrong reasons and think that the system's going to work. And so the third facet of this threshold membership is medical cost sharing. Now, I want to make sure that I'm clear about insurance versus medical cost sharing. These are two very different industries. They hold similar goals, but we have to be very clear that this is not an insurance model. This is an alternative model to insurance completely, but this is not a representation of insurance. We don't have the same legal words that we can use. We have a lot of things that translate pretty same. But we also need to make sure that this is not driven, sold, or designed as insurance, because that's a whole different industry. We're choosing to look at other opportunities. So medical cost sharing is a nonprofit organization that gives people, like-minded people, a really big group leverage of money by choice that we put into it. So a monthly contribution is what we call it. And we have the same opportunity that insurance provides. You pool a bunch of like-minded people with an amount of money, with a team that knows how to hold and work through healthcare situations. You have a team of people that, one, care, that two, aren't out for the idea of making money off of a healthcare crisis. I think that being a nonprofit is probably one of the most important parts of this conversation. They do not have leverage in making money off of your healthcare event. I think in general, that's a wonderful thing. And then three, being able to provide a service for this catastrophic space where any one of us would go broke. You know, if we ended up with an unfortunate event and a really, let's say, a bad car accident, if we had to have 2 or 3 surgeries, take care of all the time off work, everything else we have, don't we want to feel safe knowing that that's protected on the day-to-day life of our families, of our health, and not to be jerked around in the moment of need of, is that coverable? That's what I'm here to tell you. There's a different way to do this. And I've spent a lot of time thinking about this. So natural preventive medicine, I've talked a little bit about what it is. It's another way to look at health. I do primary care for a lot of people in this basis because I think truly that it's healthcare for healthy people. I have a base of people in a group all over the country I get to practice. This is the beautiful part. Nobody has rules about what's billable and what's not. Natural medicine comes from all of us together. And when we work in that way, prevention isn't just screenings and mammograms. It's defining how you eat. I mean, you go down the rabbit hole on Facebook and see, you know, all the different food trends, all the different things. It may or may not fit in your body. It may or may not fit in the science of your life. Who knows, right? But that's why we have prevention. And natural medicine is a perspective, excuse me, of prevention that can keep you from having to engage in a healthcare system as much. There's huge studies about longevity. There's huge things about when we do actively take on prevention. What does that mean? What does it look like? Wouldn't you love the opportunity to have somebody help you deal with your stress, not just say, oh, you have a lot of stress in your life. Yeah, there's ways to do that. You know, the pathway to health. I mean, this is what we do in a deep health history. We know how to move energy in the body, and that's not woo-woo anymore. That's, you know, real science that we have known for centuries. But the expression of a modern clinical application hasn't really gotten on the path of, what do I do with myself in this situation? How do I deal with stress? Where does it release? How does it work in my body? Let's talk about that stuff. That's a healthcare, you know, space. The mastery of ourselves, again, being our own best doctor. What an opportunity to have to be able to look at health from the front end instead of making it wait until we are sick and there's things that are out of our control. Direct primary care, again, it removes the traditional system of calling for an appointment, being 3 months out. There's a lot of primary care docs that are moving to a direct primary care model because it works for them too. As a practice, doctors, you know, they don't like the 7-minute appointments any more than you do. Frankly, they're overworked. They are definitely underpaid in a primary system. They get jerked around a lot. The expectations around that is just not cool. So a lot of primary good doctors are changing their practice to a direct primary care. That's a membership-based medicine. So they have a smaller group of people. Maybe 200 or 300 people in their patient base is a full practice, whereas a regular primary care or a group of partners in a GP practice, you know, they'll have 1,200 to 2,500 people underneath them as far as who they're taking on and care of in practice. For me, I think that having a doctor that knows my name, maybe knows my story, maybe even remembers who my kids are, would be really cool. It's a trusted partner. And what direct primary care can do is give you better healthcare when you need it. You know, they don't have the 7-minute appointments. Direct access means that they're open. Have you ever tried to email your doctor? Do you think you can find them? They're very protected in a normal model. These are, hey, I want you to reach out. I want to take care of you. These are really important parts of this. There's no co-pays. There's no insurance parts on this. This is a monthly fee that, depending on your situation, can be as cheap as $40 a month. It can be way up in the hundreds of dollars with these areas called concierge medicine. It depends on your level of service. Do you go to the doctor a lot? There's a reason we should find your space. Do you hardly go to the doctor at all? Let's find the right pathway for you and know how to utilize what's offered there better. I think direct primary care is going to be a very new model. I also think that it's important to share in this group that as we evolve the direct primary care world and the medical cost sharing world, insurance is, they're not they're not dumb to what's happening. So there's a lot of lobbyist groups. There's a lot of money tied up into making sure that there is a lot of legal boundaries around who can practice direct primary care, who can offer medical cost sharing. These are all things that, yeah, hurdles when it's also realized that it's a pretty good idea. So a direct primary care doesn't have a copay. It has a membership. So a monthly fee, again, somewhere between 40 and 200 is usually normal. I charge $69 a month. There's a lot of people in the $80 to $100 a month. Depends on what you're looking for. But you get access to your physician. You get access to truly talk about health, not just the symptoms that show up. And then the medical cost sharing. So if you had this, and this is really important, I'm going to read this direct. I know you can read, but what if your safety net was built on real humans without an agenda of making money off of you, without policies that are there to not help you? To what if we offered real healthcare services in your time of need? I think this is, I want to believe that this is an important factor in where our world is going in this country, in this society, in our culture. I want to be able to work off of transparency. And I think medical cost sharing and my experience within that and providing that opportunity now is really important. And in this day and age, I think it's even more important to say, we're going to reestablish relationship with people. So having the safety net of a situation here is much like insurance. It's going to get, things are going to get covered in the event that we need help. That's where we sort out a lot of these details. So same thing as like an insurance policy, right? So a medical cost sharing, so that it's kind of, you can see how it works. It's a monthly contribution, but it's an alternative to an insurance copay or deductible or any of those. So it's a protection similar to the same thing of insurance. And it covers you from big things. It's not going to cover all of your little things. And that's designed for a reason. If we want everything covered in our world, we have to pay into that. There is a cost to all of that. So if we learn from the model of healthcare to really take it back onto ourselves and say, hey, if I choose to take care of myself, I don't have to put as much money into this situation because I can't play the odds of my own body and my own life, my own choices. They say, I'm doing pretty good. And in the event I'm not, you're still here to help. That's where the medical cost sharing becomes really important. It's a clear and transparent model. There is nothing easier than signing up for a system like this for medical cost sharing. You would think it would be really big and complicated, and we've learned that through the insurance world. But guess what? This is an agreement. This is nothing more that says, hey, you choose to pay every month into a system that will take care of you, and the promise in return is you will get taken care of. And very, very few questions are asked. It's not a let's nitpick and nickel dime. Let's go ahead and take care of people for what they're worth. And that is really, really important. And this model is changing the rhetoric on, dealing with the oh gods of the healthcare system. It also keeps the freedom and the choice of healthcare sanctuary in your own sovereign needs. Getting kind of flipped around with people that have to go to their in-network providers, that have to go to a surgery center that, your insurance dictated. I don't know about you, but I don't know that I feel like that's healthcare. I want them to tell me how that works. I want to be more in charge of my own healthcare than kind of sent down the path of other people's versions. So a freedom from restrictive networks, flexibility, transparency of what's happening. The best part about, medical cost sharing at this point is the groups are growing. The company that I work with and that I'm affiliated with has very, very big base. I think we're at 1.3 million people. So this isn't just like you're kind of, your local community guys hoping for the best. There is definitely a leverage there of having a group of people that are on your side, that they have a leverage team, and they call it their leverage team, where they can go and talk about, hey, this is scheduled for surgery. we're going to negotiate a price here that's real, that's clear, that's transparent, and that's not about an insurance rate, because you know those are ridiculous. When you look at what those charging costs in hospitals, there's a game a mile long. And again, I don't need to start down that path, but I think everybody that's been in the healthcare world knows how important that is to address. And we're going to call it what it is. You know, there's smoke and mirrors everywhere. There's things you never know if you're going to get it covered. You don't know, you know, what is you're getting bent over and what you're not. So I feel like that's a really important place that we're offering some important alternatives or options. So again, there's three cogs in this wheel. To make any sort of health work, we've got to kind of have all three. Prevention is, how do you choose to take care of yourself? Whether that's with me, whether that's another natural medicine provider or a prevention, you know, lifestyle medicine docs are gaining ground here in this country a ton. That's an important part, because I think at this point, people really do need to understand that that system and the way it is not designed to necessarily take care of you. Yes, in the event of crisis, there's things that they do a good job of. But in terms of taking care before you get sick, I think there's better options, an important space in those cogs and those wheels. Direct primary care, again, we've talked about how important that is to have that. You know, there's nothing like, you know, having ability to call and really put things at ease, get things taken care of, that can be dealt with quickly and effectively. And then the medical cost sharing. These are things that are out of our control. And we don't deserve to break everything we've ever built in our lives because we've had a healthcare event. And that's really why I build this long-term, is because I don't think anybody should ever have to choose between food and healthcare. I don't think anybody should go broke because of a healthcare event. So, you know, we're talking about traditional models versus threshold, and you can see, you know, kind of side by side. Prevention is not really dealt with. It's extra cost, it's bonus, it's whatever. What if we knew what supplements to take? What if we knew, you know, where our tendencies, where things went bad? It's pretty cool to talk about prevention. And then what's included? You know, that conversation I have every single day with people, and it's awesome, and it's totally on the front end of their health, and you can see it. You can see it in their longevity, you can see it in their vitality, and it's worth every ounce of money they put into themselves. Primary care. Again, the pay per visit model. You can pay out of pocket at a primary care up to $300 to $500 in a lot of places. And in direct primary care under threshold, we have it taken care of. And whether you live here in Colorado, where I am, we will find you a primary care wherever you live. And the beautiful part is you have an opportunity to do a lot of that online. I know, you know, my primary doc is not here locally. I have a great relationship with somebody that lives, I think it's like 96 miles away from me, because 90% of what I need that can be dealt with online. How often do you go to a doctor in primary care where they actually physically need to touch you? Yearlies, yeah, there's things, right? But generally, if you call and you have a sinus infection, if you have a urinary tract infection, if you have, you know, things that are like, oh, I see the problem. Oh, let's take care of business here. That can be done over the phone. It can be done on a video clip. I don't want people to feel afraid of telehealth this day and age. I think it's very useful. I think there's very good doctors doing telehealth. And I think it's very much a good opportunity for people. Time, money, efficiency, and good healthcare. So having that opportunity is a great thing, both in person and online. There's tons of hybrids to do that. And then your major medical expenses, right? These are things that are what breaks us in the world. Not that we wish this on anybody, but this happens very regularly. We need an affordable way to do that. I'm sure that's why a lot of you guys are here today, is because that's becoming really in our face. And if we don't have a job that provides healthcare, I'm in my business for myself. I'm hoping some of you are. I think there's a lot of situations where healthcare is not provided. I couldn't honestly afford healthcare in insurance out of pocket for me and my family the way that it is on the health exchange and in Colorado where I live. So it would burden everything in my family and affordability to be able to have healthcare. And if that happens, how often does that happen to many of us? This is where this drives this conversation and why I put this together. to make this easier for people to see what you can put together for your health and how to do this by design and by choice. So the membership fees, again, the three facets, the cool part that I've done is try to make this a cohesive conversation. Option one, option two, option three, take it or leave it, option two and three, option one and three. This is for you to decide. So deciding what it is to feel like it's a good solution for you. Some people are really good at taking care of themselves preventatively. That's awesome. They may not need preventive care. There might be people that, have their own doc and they just love them and they're good with it and it feels great. I don't want to mess with that at all. And then there's other options where, hey, maybe you're already on Medicare. Maybe there's other things that you don't need insurance for. That's great. There's opportunities to part and piece all of these together. But the important part to know is that three options, many, many different solutions, and one organized fee. Trying to find this and part this together has been hard, even for me to build, let alone for people to negotiate. So, under my wings here of how I take care of people, this becomes a really important game changer because they can ask direct questions. They know where the value is. And when there is a problem, it gets dealt with through me and my team and everybody that knows, hey, we can call this and this gets solved. That is worth the price in gold at a lot of points. So these are just the open-ended conversations of where do we go from here? Again, three spaces that I think are really important. Flipping the conversation of healthcare, of what do you want out of your health? What do you want for the money that you put in your health? I ask a lot of people, the money that we're paying into insurance, whether that's through yourselves, whether that's through your employer, there is a huge price we pay, and it is not reflecting in our health. If we change the narrative, if we ask more of ourselves, but of our people that are in these situations, I want to be able to expect more out of my healthcare. I don't know about you, but I think that's why I'm passionate about this. This is why I built this opportunity. This is why I spent a lot of time finding and working with Sedera, who is the medical cost sharing company that I represent. I think it really needs to come down to, I want to apply this in a different way and in a place that feels in integrity, that feels like it actually does something for people. Because I've been in the healthcare world long enough where I do see that it's becoming disenfranchised, and your health shouldn't be related to that. We really need to go back to a little bit more basis of self, basis of interacting with our own good choices, create our own good outcomes. And then the power becomes, who do I want on my team to help this? I want people to know that deeply, that there is a lot more you can do about taking care of yourself in all three of these realms in health, and that we can have conversations going down. So I want to be able to answer your questions. I know there's piles of situations that people have that make this possible. I have one-on-one conversations all the time with people to get right situation, right pieces sorted out. But the big question that most people do come up with is, well, how much? Well, that depends. And I hate to say that, and it sounds sleazy, and it's not. It depends on your health. It depends on your age. It depends on your situation. It depends on your dependence. And it depends on how much risk you want to take. Just like with insurance, a medical cost sharing, I can get you a medical cost sharing for a single middle-aged person for roughly $100 a month. That being said, if you add in dependence, if you have any sort of pre-diagnosed conditions, let's face it, those are expensive to treat. It's not being judgmental. It's saying, hey, if we know this going in, we price accordingly so that everybody knows how to get the benefits out of that. That requires a deeper personal conversation. And I want to be able to have that with each and every person, knowing that they are capable of deciding, what's best for them, and that we can offer a really good solution that doesn't just take, sign that check over and hope for the best. Because I want to live in a world that doesn't do that. I want to offer healthcare that doesn't do that. And I want people, in this world with me that want to feel like healthcare is important in all of those choices. So, there's the little QR code will get you to, a good conversation one-on-one. I want to open it up right now to, just questions that people have about healthcare. I'm going to jump out of this screen. If you guys, well, I'll leave it on here. And if you guys want to jump on, open up, ask questions, let's do this, and see what's happening. Yeah, of people here today. I mean, I'm curious, of people that are sitting here right now, are people have existing insurance and they are looking for alternatives? Do they have no insurance, wondering if it's important? What does 69 cover? So the $69 a month covers preventive care, and it covers a portion of the direct primary care. So a basis of a primary care online, a direct primary, is somewhere around 40 or 50 bucks a month. So if you budget, let's say $100 to $120 a month, you can get direct primary care and prevention all bundled together for a really good working relationship with a provider. Yeah, so emergencies, yeah, definitely. So if there's, say your kiddo breaks an arm, you're still going to go to the emergency room, or you're going to go to your urgent care, whatever, the acceptable solution is for that thing. At that point, they will ask, you get all done, sorted out, everything's okay. And they say, how am I billing this? Can I have your insurance card? You're going to say, I am a self-pay. I work with Sedera Health and I work with Origins membership. And you need to give me a bill and we will get that negotiated. A lot of smaller ones pay out of pocket. It's a thing that is, if you need some stitches in an arm, there's not going to be a lot of negotiating room. It is what it is. But if there's surgeries, if there's, life-threatening things where we cardiac arrest and you end up, they're not going to bill you in the moment, but they will get a bill. Those are the direct source to call Sedera. I have a direct line to the staff and we know where the order is of people to call. Here's my situation, here's the bills I've collected. They create a team right there that says, okay, we've done this and this and this in the acute system. Now, all the follow-ups, all the things that are going to start accumulating huge amounts of money, they are going to start negotiating those rates. So emergencies happen the same way in any other level. Go to the emergency room, go to urgent care, get it dealt with. And then the money part is what's left over that says, call Sedera, call me, and we have a team that goes through and says, okay, here's what you do for this. Here's the response for this. Here's the check that we're going to provide for this. And, I've done this long enough to know that I've never had such an easy time. And I know that that's really hard to believe right now because it's like we've all been in the world of healthcare. Oh my God, you're going to sit me on the phone for 20 minutes, let alone talk to somebody. They answer the phone. They know you. They actually don't ask questions that says, send me those bills. Let me look at them. Everything's good. Yeah, I think so. Cool. We'll pay it. It really gets turned over quite quickly. So I would say before there's a lot of skepticism, and I know there's skepticism, let it ride out a little bit. That's from our traumas of going through the healthcare system. It doesn't have to be that way. There are better ways to do that. Other questions. Let's see. What percentages of those types of bills are paid? They are paid in full. So the thing is there's not a partial payment. There's not oh, we only pay, 70 cents on the dollar for that. They're either going to pay it or they're going to say that doesn't qualify. And the doesn't qualify comes from somebody didn't either pay into a system. I've never seen things actually unqualify for any undocumented reason. There is things that you do need to know, and they're very explicit up front. If you are of childbearing age, you have the possibility of getting pregnant. If you want a pregnancy covered, you need to explain that and share that. Even if it's not a planned pregnancy, if it's available. Otherwise, they didn't sign up for that risk, so they don't have that. The other thing they set a basis of is your healthcare status. Anybody that chooses to use nicotine has a base propensity of more risk categories. So their base percentage, if you use any form of nicotine, is more than a standard healthy system. I kind of think it's an important conversation. If that's the case and you're in a different risk pool, there we go. But as far as not covering, I honestly don't think that I've seen a lot of situations where anybody is left hanging, anything is left high and dry because they don't nickel and dime. It's just gathered and it's paid. So if you have a surgery, there's usually, I don't know, 9 or 12 different people and providers that are billing you. You bundle all those in one situation, you take pictures of the invoicing, you fax it to them, or you email it to them, or you let me help you do that. And we have a team and they say, oh, this is the whole thing. This is what it takes to get a new knee. Well, here you go. There's the orthopedist and the anesthesiologist and the hospital. All these things get taken together into one health event, which makes it pretty cool. So yeah, paid in full. I've never seen partial payments because I don't think that they believe in that. And I think that's actually good. Keep it clear. Another question here says, I know that a doctor's doing private healthcare. What is that? They call it boutique. Yep. Concierge. Yep. Those are all names. Instead of the 15-minute appointment, she spends an hour and a half with each client. Yeah, and that's what I do as well. So my minimums, I will do a quick phone session for 30 minutes is a quick phone session because it never turns into a 5-minute thing. It's really hard to answer. But most of my in-person appointments and my online, I work with people all over the country. I have hour time slots. Initial intakes are usually an hour and a half plus because I get a full spectrum of your health. I want to know not just healthy in your physical body. Yes, we ask all those questions, but also what is your propensity? You know, what about, your genetic makeup? That's a big part of a conversation so that we know where the basis of health is. We know what avenues of prevention are actually going to be helpful in your case. So all the times that we talk, that's the thing. Membership gives us the opportunity to say, I can take the time that I need to for you, and you actually get what you pay for. And I think that's really important in that. So I feel great. I know that, my patient base is wonderful at wanting to share. When that trust is built, when I see you as a human, not just ooh, that's a bad infection. Sorry, man. Like there is such a better conversation. There is such a more intimate level of knowing, hey, you have a tendency every year to get a really bad sinus infection in the winter. Why don't we try to prevent that this year? Why don't we look at your world and what you're eating and how to change, where you do with your stress? Hey, is sleep kicking your butt right now? Let's talk about that. There's so many ways that we can effectively help health on the front end. I hope that those are really new understandings of healthcare in general and what we can provide. There's a lot of really cool, smart doctors doing neat things in the world to help people. I want that translated directly. And that's your benefit. That's what you should be getting. How are lab tests handled? Good question. So at this day and age, there's so many different cool labs that we do. All of us provide different labs and different necessary means. Me as a natural medicine doc, I can provide most labs. Some that I can't, I will go through direct primary care channels and the teams that we all have set up. But every one of us has options to, standard blood work all the way down to nutritional deficiencies to more antihistamine and more allergy related situations, environmental toxins. There's all the different labs these days. Hormone panels are huge. And I think they're really important. A lot of times if you go to your primary care, they either won't touch those and they're like, oh God, I just don't know how time. Or they'll do just the basics and they won't dive into a situation that may take a little bit to uncover. I know people come to me and they get frustrated because, well, my doctor said that my estrogen's off. And I said, well, what about your progesterone? What about your testosterone? Well, we didn't test for that. I said, well, how can we fix hormones if we don't know where all of them lie? It's getting time to have a full conversation. And so I really hope that people get, an opportunity to know what healthcare can look like from this end and really give you guys a place where you can talk about all the little things, because all the little things are the important part of creating health in our body, in our minds, in our hearts. I mean, this is a full system spread. This isn't just a set of symptoms and things that we treat to band-aid those systems. This is, how do I want to live long and happy and healthy, and how do I want to feel every day when I wake up? It is in your propensity, in your choices, in your opportunities, and I really think that's important. One more question on lab tests. Are they covered out of pocket? They are covered. A lot of these are covered with the membership. So a standard lab every year, you know, you go get like a CBC, and you go get like your lipid panels, and you go get some basic hormone with your thyroid. Those all covered every day. And then some of them, depends on the direct primary care, will offer more. My World offers a big discount in that membership. And I'm telling you, the discount is worth it. It's 30% plus that will give you, you know, if we need to go get you a Dutch test, which is a good deep hormone test, and we want cortisol with it, and we want the whole spread, you know, a 30% discount on a $300 test is worth doing. You can go get it out of pocket, but we can get discounts there. Most general testing, you pay a phlebotomist to, you know, your nearest blood draw. You'll pay 25 bucks usually to go get a blood draw at like a LabCorp or a Quest diagnostic, somewhere in that range. And then it is per situation, but standard blood work always covered. You know, we keep tabs on that stuff. That's our basis for metrics. We should offer that. And then anything we deep dive in, we can go allergies, we can go, you know, hormones, we can go, I mean, there's many cardiovascular risk, genetics. I love genetic testing. It's one of the most favorite things for knowing your cards that you can possibly get. Yeah, so, you know, again, it's different for each situation. And I want to be able to apply the necessary tools for the right healthcare in this world, for a better opportunity for you to practice your own healthcare. Yeah, so any other questions? It seems like some people left, but I know it is during lunch hour for me, so there's a lot going on. I encourage you guys to really be able to reach out. All of my labels and things and contact information are on this chat. And if not, everybody gets a you know, a recording of this, so that'll have everything there. Anybody that reaches out directly, we will have a one-on-one conversation on really what's the best answer for you. And I would say, let's hear that and find that together, because when there is clarity, when there is, you know, straightforwardness, I feel like you tell me what's going on, I can definitely offer a solution, and you can find what's best for you. And that's really it. Yeah, and thank you for posting that. So in the chat is all the places to find me. I would say that the easiest one is through my website. I'm sort of active on Facebook. I don't appreciate it, but I know it's an avenue of connection. Instagram, I'm still learning, but if you have a kiddo that wants to help me, please sign them up. And LinkedIn, I do publish a lot of, not a lot, I publish enough on there to keep a really good conversation going, because I think this is worth the conversation. That's where it started, is I don't want to put up with healthcare that doesn't work for me. I've never been too privy to following those rules, so I've made them up to suit me, and I think it works for a lot of people. So, you know, feel free to reach out on any of those layers. You sure can find me, and all of my contact information is on the website. If there's, you know, any personal questions, please, you know, the more the merrier. The health is a personal conversation, and I'm happy to share that part.
Thank you again, Gwendolyn.
Yeah.
Looks like there was one more question in the chat. It says, do most people keep their same insurance?
Oh, yeah, real quick answer to that. I would say some people do. I would say, so the majority of people that are looking for alternatives are realizing that, you know, it's costing them more than it's doing anything for them in the insurance world. So a lot of people look into this first as an alternative to their insurance, and then they sort of understand, oh, this works pretty well. Oh, I can save money doing this. It definitely goes hand in hand. People that have Medicare, that have Medicaid, there is some rules around, you know, you can't go to a direct primary care if you are of Medicaid. Those are federal laws that I hope we fight against someday, because I think that's a crock, but it's, again, government regulated is a different world. So some yes, some no, but a lot of people turn to more natural medicine because they've been frustrated by the system. And then they're usually kind of getting bent over by insurance, so it helps that conversation. I have other people that come straight to me because, hey, I heard you provide alternative to insurance. I want to know more. Let's talk about that. So any and all, I think, are opportunities. If you like your insurance and it's covered, let's just do prevention. I mean, I have bunches of people that are just in my practice for prevention. They're happy to pay out of pocket. They get much more than they ever do going to the, a primary care of a 5-minute appointment. We play a lot back and forth in that world. And like I said, we'll use those tools where they're necessary. Sometimes I send you back to primary care so that if you do have insurance, we get that paid for. That way you're not paying out of pocket if you have insurance that works. So yeah, I hope that answers the question. And then just know that every scenario is very different and that there's many opportunities to make this work for you. So, talk to me, reach out, ask more questions, set up appointments as necessary. And yeah, we're good to go.